The Grand Ballroom of the Riverside Hotel glittered with chandeliers and champagne. The annual Children's Hospital Charity Ball drew the city's medical elite. Surgeons in tuxedos, nurses in evening gowns, administrators networking between silent auction tables. I stood near the bar in a dress chosen specifically to hide the port catheter in my chest, watching my mother hold court with her nursing supervisor friends. "Emma, you came." My mother's voice carried that professional brightness. Warm enough to seem genuine, controlled enough to maintain authority. She was head pediatric nurse at Riverside Children's Hospital, a position she'd held for 12 years. "Girls, this is my daughter. The one I've been telling you about." The one she'd been telling them about. Her project, her burden, her cautionary tale about young people who catastrophize minor health issues. "Emma's been going through some health challenges," my mother said to 3 women clustered around her, all wearing the particular expression of experienced nurses who'd seen everything. "Nothing serious, just some routine care that's been taking up quite a bit of time." Routine care. That's what she called the stage 4 Ewing sarcoma discovered in my pelvis 6 months ago. Routine care for aggressive bone cancer requiring immediate chemotherapy, radiation, and experimental immunotherapy because standard treatment hadn't worked. At 28, I should have worried about career advancement. Instead, I worried whether the pain radiating down my left leg meant the tumor was pressing on nerves again, and whether the fatigue that made climbing stairs feel like summiting Everest was from cancer or treatment. "You poor thing," one nurse said, practiced sympathy in her voice. "What kind of routine care?" "Oh, you know," my mother said breezily, waving dismissively. "Some scans, a few appointments. Emma's always been a bit anxious about her health, so her doctors are being thorough. Better safe than sorry." I felt my jaw tighten. 6 months ago, the ER doctor had shown us the CT scan revealing a mass in my pelvis. When the biopsy confirmed Ewing sarcoma, rare, aggressive cancer typically affecting teenagers. My mother had gone silent, then nodded calmly. "We'll just deal with it." Dealing with it meant minimizing it to everyone. "How are you feeling, sweetie?" another nurse asked me directly. "I'm managing," I said carefully. "The treatment has been challenging." "She's doing great," my mother interrupted, her hand landing on my shoulder with pressure signaling I should stop talking. "Honestly, I think the hardest part has been adjusting to so many medical appointments. Emma works from home as a graphic designer, so she has flexibility, but it's still disruptive." Graphic designer. I was a senior medical illustrator for a pharmaceutical textbook publisher, creating detailed anatomical drawings for oncology textbooks. I made $142,000 annually illustrating the exact cancers I was now fighting. My mother consistently downgraded my career to something resembling a hobby. "Well, you're lucky to have a mother who's a nurse," the third woman said. "Linda can help you understand medical jargon and keep things in perspective." Keep things in perspective. As if perspective helped when my oncologist had gently explained that stage 4 Ewing sarcoma had a 5-year survival rate under 30%. As if perspective mattered when I'd overheard my surgical oncologist telling my medical oncologist that if current protocol didn't work, we'd be looking at palliative care. "I try to help Emma understand that not every ache and pain is catastrophic," my mother said, her nursing voice in full effect. Calm, rational, condescending. "Young people often panic over things quite manageable with basic treatment protocols." Basic treatment protocols. I was receiving cutting-edge immunotherapy at a research hospital, participating in a clinical trial because my cancer was too aggressive for standard care. I'd lost 28 pounds from treatment. My hair had fallen out in clumps until I'd shaved it and started wearing wigs. I had a port surgically implanted in my chest. Nothing about my situation was basic. "Mom," I said quietly, "I don't think. The important thing is staying positive," she continued, speaking over me. "Emma tends to focus on worst-case scenarios, but I keep reminding her that modern medicine is advanced. What used to be serious conditions are now just routine care situations. It's all about perspective and not letting anxiety spiral." One nurse nodded sympathetically. "It must be hard having a daughter who struggles with health anxiety. Should she see a therapist?" "I've suggested it," my mother sighed in a way suggesting I'd refused reasonable advice. "But Emma's convinced her situation is more serious than it is. You know how some patients become attached to their diagnoses? It becomes their identity." I felt something crack inside my chest, something less tangible than bone but more painful. attached to my diagnosis. As if I wanted stage 4 cancer. As if I enjoyed chemotherapy that made me vomit until my throat bled. As if I'd chosen radiation burns that made sitting painful for weeks. As if I was clinging to terminal illness for attention rather than terror. Actually, I said, my voice harder than intended, I have stage 4 Ewing sarcoma. Rare aggressive bone cancer. I'm not anxious about basic health care. I'm in active treatment for a life-threatening illness. The nurse's expressions shifted. My mother's face went rigid. Emma, she said, her voice dropping into a childhood warning tone. This isn't the time or place. When is the time? You've been calling my cancer routine care for 6 months. You've told everyone I'm anxious and overreacting. You've minimized everything until people think I'm a hypochondriac instead of a cancer patient fighting for her life. You're being dramatic, my mother hissed, professional mask slipping. We're at a charity event. I'm representing the hospital. Can you please not make a scene? I'm not making a scene. I'm correcting your lie. It's not a lie, it's perspective. You're young, you're strong, you're getting treatment. There's no reason to tell everyone you have cancer like you're dying. I might be dying, I said flatly. My 5-year survival rate is under 30%. My tumor hasn't responded as hoped. I'm in a clinical trial because standard protocols failed. That's not routine care, Mom. That's serious oncology. The nurses had gone silent, sympathy morphing into professional concern mixed with social discomfort. Excuse me, a voice said behind me. I'm sorry to interrupt. We turned. A man in his 60s stood there, distinguished in a perfectly tailored tuxedo, silver hair and sharp eyes radiating authority. I didn't recognize him, but my mother's face went pale. Dr. Harrison, she said, her voice suddenly small. I didn't see you there. Clearly, he said, professionally neutral but his eyes hard. I couldn't help overhearing. You're Linda Cooper, correct? Head pediatric nurse at Riverside Children's Hospital. Yes, sir. And this is your daughter Emma? Yes. He turned to me, his expression softening. Miss Cooper, I'm Dr. James Harrison. I chair the hospital system's ethics committee and sit on the state medical licensing board. He paused. Did I hear correctly that you have stage 4 Ewing sarcoma and are currently in treatment? I nodded, unsure where this was going. And your mother, a registered nurse with over 20 years of experience, has been describing your cancer treatment as routine care and suggesting you're anxious and overreacting? Yes, that's accurate. Dr. Harrison's jaw tightened almost imperceptibly. He looked back at my mother. Mrs. Cooper, you're aware that Ewing sarcoma is a rare and aggressive malignancy with significant mortality rates? Of course, my mother said quickly. But Emma is responding to treatment. Is she? Dr. Harrison interrupted. Because I just heard her say she's in a clinical trial because standard protocols failed. That doesn't sound like good response. That sounds like refractory disease. My mother opened her mouth, then closed it. I'm also concerned, Dr. Harrison continued, voice hardening, that a senior pediatric nurse at our flagship children's hospital is publicly minimizing a stage 4 cancer diagnosis as basic treatment and routine care. That suggests either fundamental misunderstanding of oncology or deliberate misrepresentation of medical facts. I was just trying to keep things positive. Positive? Dr. Harrison's eyebrows rose. Or dismissive? What I heard was a healthcare professional telling colleagues that her daughter's terminal cancer diagnosis is anxiety-driven catastrophizing. That's not optimism, Mrs. Cooper. That's medical gaslighting. The nurses who'd been sympathetically listening minutes ago had taken subtle steps backward. The term medical gaslighting hung in the air like an accusation. I would never gaslight my daughter, my mother said, voice shaking. I'm a nurse. I understand. Do you? Dr. Harrison cut in. Then explain why you're at a hospital charity event telling colleagues that stage 4 bone cancer is routine care. Explain why you're suggesting your daughter needs therapy for health anxiety when she's literally in an oncology clinical trial. Explain why you, as a medical professional, are providing false information about cancer severity to other healthcare workers. I didn't think of it that way. That's precisely the problem. Dr. Harrison pulled out his phone. Mrs. Cooper, I need you in my office Monday morning at 8 a.m. We need to discuss this with HR and the chief nursing officer. I'm also recommending immediate peer review of your patient interactions, particularly any cases involving pediatric oncology patients. My mother's face drained of color. Dr. Harrison, please, that's not necessary. It absolutely is necessary. If you're minimizing your own daughter's stage 4 cancer as routine care, I have serious concerns about how you counsel families in your unit. Do you tell parents of pediatric cancer patients that their children's conditions are basic treatment situations? Do you suggest they're being dramatic when expressing fear about prognosis? No. I would never. You're doing it to your own daughter, Dr. Harrison said flatly. That's documented right here, right now, in front of witnesses. He gestured to the 3 nurses. These colleagues heard you describe stage 4 Ewing sarcoma, a condition with significant mortality, as routine care requiring prospective management. That's either gross medical negligence or deliberate emotional abuse. Either way, it's unacceptable from someone in senior nursing position. One nurse cleared her throat. Dr. Harrison, I think there may have been a misunderstanding. Was there? He looked at her directly. You were standing here when Mrs. Cooper said her daughter was anxious and catastrophizing. You heard her describe active cancer treatment as routine care. Did you question that characterization? Did any of you ask what condition required such extensive appointments? Or did you all just accept the narrative that a young woman is being dramatic? The 3 women exchanged uncomfortable glances. No one answered. Dr. Harrison turned back to my mother. Mrs. Cooper, effective immediately, you're on administrative leave pending review. You'll receive formal notification Monday. I'm also recommending the state nursing board review your license to determine if you're fit to practice with this level of medical judgment and patient advocacy failure. You can't do this, my mother whispered. This is my career. I've worked here 12 years. And you've been minimizing your daughter's terminal illness for 6 months, Dr. Harrison said coldly. How many families have you counseled during that time? How many parents have you told to keep perspective when terrified for their children? How many patients have you dismissed as anxious when expressing legitimate medical concerns? He looked at me again, expression gentler. Ms. Cooper, who is your oncologist? Dr. Patricia Reeves at University Medical Center. I'm in her Ewing sarcoma clinical trial. Dr. Reeves is excellent. She wouldn't have put you in a trial unless standard protocols failed, which means your disease is serious. He pulled a business card from his wallet. This is my direct number. Call me Monday. I'm connecting you with our patient advocacy office and social work department. You should have support services, counseling, support groups, practical assistance. Services your mother, as a nurse, should have arranged months ago. Thank you, I managed. He nodded, then addressed my mother one final time. Monday 8 a.m. Don't be late. Your career depends on how you handle this review. He walked away, leaving my mother frozen among colleagues now looking at her with expressions ranging from shock to disgust. Linda, one said carefully, your daughter has stage 4 cancer? My mother's professional mask had shattered. Tears ran down her face, smearing carefully applied makeup. I was trying to protect her. If we don't talk about how serious it is, maybe it won't be real. That's not protection, the nurse said firmly. That's denial. And it's cruel. I turned and walked away. Behind me I heard my mother calling my name, but I didn't stop. Monday morning, Dr. Harrison's office called. A patient advocate named Sarah explained she'd been assigned to my case. She asked about my support system, treatment schedule, practical needs. When I admitted I'd been managing everything alone because my mother had convinced our family I was overreacting, Sarah's professional composure cracked. That's unconscionable. Especially from a healthcare professional. Let me connect you with resources immediately. By Monday afternoon, I had a counselor specializing in cancer patients with unsupportive families, a support group meeting scheduled for Wednesday, and a social worker coordinating transportation assistance. My mother tried calling from different numbers. I blocked them all. She sent emails. I filtered them to spam. She showed up at my apartment. I didn't answer. Tuesday morning, I received a letter from Riverside Children's Hospital's legal department. My mother had been placed on unpaid administrative leave pending full investigation into her patient care practices. The nursing board had opened formal inquiry into her license. Multiple families she'd counseled were being contacted for review of her professional conduct. Wednesday, the news article appeared. Senior nurse under investigation for alleged medical minimization of daughter's cancer. It didn't name me, but detailed how an ethics committee chairman had overheard a nurse describing her daughter's stage 4 cancer as routine care and anxiety-driven catastrophizing. Other families had come forward describing how my mother had dismissed their concerns, told them they were being dramatic, suggested their seriously ill children were fine when they weren't. The hospital released a statement. Riverside Children's Hospital takes patient advocacy extremely seriously. Any employee found providing medically inaccurate information or dismissing legitimate health concerns will face appropriate disciplinary action up to and including termination. Thursday, my mother's nursing license was suspended pending formal review. The board cited gross negligence in medical judgment and patient advocacy failure, along with potential emotional abuse of vulnerable patient population. Friday, a certified letter arrived from my mother. Handwritten, desperate. Emma, I know you won't talk to me, but please read this. I was wrong. So terribly wrong. I thought if I didn't acknowledge how sick you were, maybe it wouldn't be real. I thought if I kept things light and positive, you'd stay positive too. I didn't realize I was hurting you. I've lost my job. I'm probably losing my license. But that's nothing compared to losing you. Please forgive me. Please let me be there for you now. Please. I read it once, then put it in a drawer. Maybe someday I'd respond. But not today. Not while I was still in treatment for the cancer she'd called routine care. 6 weeks later, my mother's employment was officially terminated. The nursing board revoked her license after finding she'd demonstrated fundamental failure of medical judgment and patient advocacy incompatible with nursing practice. She'd have to complete extensive remediation before even applying for license reinstatement. She'd called my stage 4 cancer basic treatment at a charity ball, minimized my dying to impress colleagues, told them my legitimate medical crisis was anxiety requiring perspective. The ethics committee chairman had been listening. Her medical license review started that night and ended her career. I was still fighting for my life, but at least now I was doing it without someone telling me my fight wasn't real. Sometimes the treatment that saves you isn't the medicine. It's removing the toxic people who make you doubt your own dying.